intended to. I want to acknowledge the OCLC Research Library Partnership, which both underwrites and inspires our work. Attendees from this webinar are from the OCLC RLP, and I want to thank you for your continued support and input into our work. These are both crucial to our success. So today, I am really thrilled to welcome our presenters, Courtney Muma, Deputy Director from the Texas Digital Library, and Sybil Schaefer, Digital Preservation Analyst and Chronopolis Program Manager from UC San Diego. And they will introduce themselves. And I am going to go ahead and turn things over to Sybil, who will kick things off for us.
Thank you, Marilee. As Marilee just mentioned, I'm Sybil Schaefer. I'm here at UC San Diego, and I manage the Chronopolis program here. And with my colleague, Courtney Muma, the Deputy Director of the Texas Digital Library. And today we are going to talk about an IMLS grant that we're working on. Courtney, do you want to forward the next slide? So we're going to give a bit about the overview of the investigation that we're doing for this grant, including the problem that we're tackling, our goals, methods, and timeline. And then Courtney is going to delve into some of the use cases that we've gathered, a listing of the agreements that are necessary for the networks that we'll be talking about, and then elements of a distributed digital preservation network for private and sensitive data, which is what this grant really is about. And those elements include technical elements, governance elements, and cost modeling elements. And if you could forward the slide, thank you, Courtney. So I'll be providing the overview of the investigation, including the problem, goal, partners, methods, and outcomes. Before we delve into the grant itself, the grant really is about distributed digital preservation. And I'd like to take the opportunity to define that term, since we'll be referring to it throughout this presentation. And so when we say DDP, we're pretty enmeshed in this world and say DDP pretty frequently. And just so you know, that means distributed digital preservation, which means it's distributed digital preservation methodologies hold that any responsible preservation system must distribute copies of digital files to geographically dispersed locations. It also must preserve, not merely back up these files in these different locations. And that's the definition provided by the Meta Archive in their Guide to Distributed Digital Preservation. Meta Archive is actually also a DDP service. And it's not just about distributing the copies geographically. They also list a whole bunch of other qualifications for DDPs, including that the sites preserving the same content should not be within a 75 to 125 mile radius of one another. They should be distributed beyond the typical pathways of natural disasters, such as hurricanes, typhoons, and tornadoes. The preservation sites should be distributed again across different power grids. They should be under the control of different system administrators. And this is one that I really feel is important to underscore, because a lot of folks think, oh, well, we have, things distributed in Glacier, in the East Coast and in Oregon. But if they're under the same control, the control of the same group or person, there's a risk there. For security purposes, all preservation copies should not be accessible by one person or team of people. They should instead have control and monitoring of each preservation site handled locally by each site in order to ensure that the network's content are not subject to one point of human-based failure. Content preserved in the disparate sites should be on live media and should also be checked on a regular basis for bit rot and other issues. They should be replicated at least 3 times in accordance with the principles that I've already listed. And regardless of what technical infrastructure a DDP network adopts, The network will perform three main tasks: content ingest or harvest, content monitoring, and content retrieval. And each of these tasks may vary radically across different technical infrastructures. Next slide, please. So the problem that we're really trying to solve with this grant is the fact that although DDP services have been made available as offerings in the United States for well over a decade, there isn't a DDP service available for private or sensitive data like PII, personally identifiable information, or PHI, personal health information. For this reason, we propose that those two types of information, as well as the other sensitive data that's in the custody of libraries, academic health science centers, and archives, is at an escalated risk of loss. Academic health science libraries especially face a growing backlog of digital PHI governed by HIPAA. And additionally, university-held cultural heritage collections are likely to have materials governed by FERPA requirements, as well as valuable cultural heritage materials that contain PII, such as social security numbers and other data deemed sensitive or private based on local and jurisdictional policies, as well as university and other institutional policies. So as part of this grant, one of the assumptions that we made, and that we'll be touching on and discussing a little bit in the final reporting, is that we are making the assumption that the bar set by HIPAA and FERPA regulations is sufficiently high to protect many other kinds of non-regulated sensitive data. So the goals of this grant are really to determine the capacity and feasibility of a national distributed digital preservation system that would close this gap for sensitive data like PII and PHI. The technology, infrastructure, and expertise needed to build this type of service for sensitive data exist, but the connections, agreements, and processes to put it all together to form a viable service are lacking right now. And since such an offering would be the first of its kind, we thought it would be wise to kind of lay the groundwork and identify what is needed to actually provide this service before trying to do so. And so I should mention that building the service is actually outside the scope of this one-year planning grant. But the two lead institutions, UC San Diego and the Texas Digital Library, are interested in using the grant deliverable to assess their capacity to meet the outlined requirements and to initiate discussions with possible network partners. So I've mentioned the two lead grant partners, UC San Diego and TDL, and both have well-established business models and extensive experience in building and providing DDP services. The Texas Digital Library is a consortium of Texas higher education institutions that builds capacity for preserving, managing, and providing access to unique digital collections of enduring value. Since 2015, TDL has also offered access to DDP storage systems. In 2017, TDL joined the Chronopolis DDP network at UC San Diego and now provides access to Chronopolis services to its members, and also serves as a replicating node for the network using storage at the Texas Advanced Computing Center, or TAC. UC San Diego, the library here manages the internationally recognized DDP service, Chronopolis. This service, which is the one that I manage, spans 3 sites across the United States, and it's actually one of the earliest established DDP services in the world. We've been in operation for over 12 years. And we partner with the University of Maryland Institute for Advanced Computing Studies in College Park, Maryland, with TDL in Austin, and then our third site is here at UC San Diego, actually housed in the San Diego Supercomputer Center. We offer preservation storage through DuraCloud, which is now a service provided by Lyrasis, and also through the Texas Digital Library. And we were certified as a trusted digital repository by the Center for Research Libraries in 2012 and are planning to undergo ISO 16363 certification in the future. So both of the project partners maintain close working relationships with organizations affiliated with their home institutions that could provide key resources to instantiating a DDP service for PHI and PII. The Texas Advanced Computing Center, or TAC, which I've mentioned at UT Austin, has partnered with TDL on several projects through the years, and they independently offer secure HIPAA, FERPA compliant storage to their local partners. So they've already got that service set up locally. And similarly, the San Diego Supercomputer Center here at UCSD provides HIPAA compliant storage to UCSD faculty and researchers. So we're working with both computing centers to share their who will share their expertise in providing sensitive data solutions, including service and cost modeling with the project team. We're also partnering with a large number of other institutions who are interested in tackling this problem space. We are working with representatives from AP Trust, the Smithsonian Institution, Northeastern University, the University of North Texas Health Sciences Center, the University of Texas Southwestern Medical Center, the Dell Medical School at the University of Texas Austin, and the Maryland Advanced Research Computing Center at Johns Hopkins University. And they've all expressed interest in this project as they have sensitive data that they need to geographically distribute and preserve. We're also contracting with Security Metrics, who are experts in HIPAA compliance, to provide guidance in policy creation and to review legal documents and technical requirements. So our methodology for digging into this investigation really starts with gathering information. We've hired a graduate research assistant, Hassam Andalib, who is gathering use case, conducting use case interviews, and gathering all the different agreements between the parties that are currently in place. There's actually quite a few, and creating kind of a network technical diagrams so that we can highlight where any gaps may be. We've gathered more information in person from our discussions in our meeting in December, and we're working to determine where those gaps exist. And we'll also be investigating service and cost models and then disseminating our findings at the end of the one-year term. So on the next slide, you can kind of see the timeline of our grant, which is, as I mentioned before, a one-year planning grant. So we started in September of 2019 by hiring Hassam, and then he really undertook the initial data gathering. We had a really successful meeting in December with all of our project participants, where we discussed additional use cases and some of the elements of a successful service. We're now using that information that we gathered during that time to outline our final report, and we're also working with Security Metrics, our compliance experts, to really determine how our current slate of agreements and technical infrastructure would need to be adjusted to be HIPAA compliant. When we have solid drafts of the report and legal templates in place, we will be disseminating those to our project participants and then have a second meeting in August, this time virtually, to gather feedback on those drafts. And then finally, we'll finalize the report based on that feedback and publish it and any agreements and templates and cost modeling that we'll develop. So that will be made available publicly. And with that, I am now going to turn it over to Courtney.
Hi, thanks, Sybil. I had to change the view for a second so I could find my unmute. Can someone tell me that you can hear me okay?
You sound
We
great.
can hear you, yeah.
Okay, great, just checking. All right, so some potential outcomes, we're pretty much open to anything. This has been a very interesting experiment so far, and so we're kind of ready for any outcome, but this is what we're thinking. Whatever our roadmap and our recommendations are, they're likely to include, hopefully some definition of what a DDP solution for private and sensitive data would look like. We're hoping that through all of the partnerships and outreach we've done and are doing during the term of this grant, that we can establish new technological and community partnerships. And then it's highly likely that we'll need further projects and possibly grants as well to move this effort forward as we establish feasibility and the need in our community. We also acknowledge that there could be a conclusion that, at least for right now, DDP for private and sensitive data is not quite feasible yet. We're seeing a lot of barriers emerge, and I'll talk more about some of the challenges later, but we're seeing lack of user readiness, cost barriers, and barriers around technological complexity very early on in the grant. So far, I'm going to get into the use cases, and so far we've collected detailed information from UT Southwestern Medical Center, UNT Health Science Center, University of Connecticut Library, and Dell Medical School. We also, excuse me, we also need to know if institutions know they have sensitive data that justifies a high level of preservation. In some cases, we think that institutions suspect that there is private and sensitive data that requires a high level of preservation action, but that institution might not have done the level of assessment or appraisal necessary to quantify the problem sufficiently. And that's partially because without a solution, there's not a driver to make those decisions kind of weighing down and pushing along development. In our in-person meeting, we had a really good discussion about the types of private and sensitive content that should be preserved in such a network. And we also talked about a lot of the barriers perceived and not. Some of the things that came up were really looking at human rights records, for instance, like first-person accounts of trauma. And also we were looking at commerce-related restrictions, and this fell around especially a lot of the medical research at the medical libraries. You're welcome to go ahead and look at any of those use cases and their summaries at the link that we've provided here. Excuse me, I'm sorry, I have a cough and I'm really trying not to cough at y'all, so when I pause, I'm drinking water. We have also conducted a review of where and what kind of agreements are in place, as Sybil mentioned. And we're looking specifically at the agreements that enable existing DDP networks with which the project partners engage. So that's Chronopolis, the TDL Digital Preservation Services, AP Trust, and DuraCloud. Such connections include agreements between infrastructure nodes, as well as service contracts and agreements that enable DDP networks to function. Additionally, we'll be reviewing the agreements, policies, and procedures that allow the Texas Advanced Computing Center and the San Diego Supercomputing Center to accept the types of private and sensitive data that they currently do. So let's look at some of those types of agreements that we've collected so far, and this is just a small sampling. If you'd like to take a look at what we're calling the legal binds for distributed digital preservation services, you can follow that link to our project wiki and look at all of the different agreements in place just to enable this distributed digital preservation service. So some of the examples are software licenses. So for instance, licenses for using the open source DuraCloud software, Chronopolis' software license, and AWS, which does play a role in some cases in some of these systems. So that's Amazon Web Services agreements. We're also collecting contracts, service level agreements, and various MOUs. It depends on which connection we're looking at to determine which of those things are in place. And so for instance, we've got agreements between the service provider and the storage node. And so an example of that would be Chronopolis and NCAR or TDL and TAC. There would be the service provider and then the depositor, which is usually based at one of the institutional members, so UC San Diego Libraries and UCSD. And then service provider and service provider, so that's like Chronopolis's relationship with TDL and DuraCloud's Lyricys's relationship with Chronopolis. We're also collecting requests and authorizations. The way that TAC is providing access to their private and sensitive data service is through just a researcher authorization agreement that basically UT Austin researchers can just log into with their UT Austin identification, and then they're good to go. And so our amazing GRA, Hissam, has started kind of making graphics to illustrate all of these agreements and interconnections. And I'm finding this very interesting, and it was interesting to present this as well to our in-person meeting group, because I think everyone was surprised to see how many connections, and you can see them listed out, and that seems like a lot, but then when you look here, you really see all of these different interconnections that are necessary just to keep this these services running properly. So you'll see here we've got all those data depositor agreements at different places. We've got SLAs and MOUs. We've got research agreements. We've got standard licenses and licenses from open source systems. And all of them are necessary to enable the work that we do. You're welcome to look at this. Again, all of these legal binds are listed on the website. And as soon as we get this graphic absolutely correct, which has been quite an effort because we have so many participants. So once we have a final version of this, this will also be on that page. And just as a matter of comparison, we wanted to do the same thing for our partners at AP Trust. And because they're using all Amazon Web Services, theirs is a much more simplified graphic, because really you're just looking at contracts there with Amazon. So some challenges that have emerged, especially after the in-person meeting and certainly over the collection of the use cases and conversations we've had with partners over email since, are these. First, the alignment and enhancement of these agreements. So according to HIPAA rules, we actually need business associate agreements rather than the MOUs and other such agreements that we have been using. And so we realized that we have to probably reduce and change some of the kinds of agreements in place in order to effectively launch any DDP service for private and sensitive data. We've seen issues of liability, which I'll get into a little bit more in the next few slides, but especially identifying stakeholders who are going to be the most likely to take on the liability requirements of this work. Issues of control, so thinking about the technical and security controls for the liable body, so whoever decides to take that responsibility. The complexity of the technical architecture is challenging, which is sort of illustrated a little bit in the graphic I showed you about the agreements, but we also have another graphic that we're creating just to show the software and infrastructure interconnection. But it is very complex. And it is a bit prohibitive because it means, certainly for HIPAA, you have to have HIPAA requirements applied at every single connection, every single part of that network. And then readiness, finally. A lot of institutions, as I mentioned before, are just simply not at the assessment and custody stage that even requires a DDP option. So they, even if there was a service, there wouldn't be necessarily content identified to put into that system. So I mentioned I want to dig a little deeper into stakeholders and their roles, and this is really, the next few slides are results of our in-person meeting. So one of the things that came up, no matter if we were talking about agreements that were in place or use cases or technology, was who are all the stakeholders involved? Because anytime we're going to be creating a service, we need to think about that. And so this is a list of what we gathered from the in-person meeting. Of course, we're willing and excited to expand it if you have other ideas. But right now we've got depositors, and in our notes from the meeting, we actually had a question around depositors, thinking, who exactly is that? And is it always the same for every part of the network? You've got your preservation staff, so those repository managers, the archives, the developers, the service providers. Then you've got the people in the data, so a person in a photograph or who's represented in a health record, someone related to a person in the data, and this applies especially to the health records. Then the communities that are represented by the data, so not just individual persons. And then, of course, the original creator of the data, the doctor, the researcher, etc. We also have to think about the future users of the content as stakeholders here. Administrators include academic deans, the EVPs for health systems and research for clinical and research data, the presidents for overall support and approval, the university CIO and librarian. And then we really got stuck on a big conversation in person at the meeting, largely driven by our representative Jen Stone from Security Metrics, that HIPAA compliance firm, around data ownership, which is a very complicated issue in the States. So we'll go into that a little bit, but again, I want to emphasize we're willing to expand this list. So if you have more ideas, please share them with us. So let's talk just a little bit about this issue of ownership. Without knowing who owns the data, it can be really hard to make good decisions about digital preservation of that data. Typically, the data owners can make the decisions unless the law indicates otherwise, and that can be regional and jurisdictional. Nonetheless, in any use case, management decisions do come down to data ownership. The owner decides ultimately about destruction of data, for example, and decisions about use come down to ownership as well. Ownership generally drives policies and management decisions. So we have to think about in every case, in every use case that we collect, who owns, for instance, patient visit data? Is it the doctor? Is it the patient? Is it the insurance? Even with medical records, there is an emerging interest in old written records that have been or are being digitized. And so how do we establish ownership around, records from the late 1800s and early 1900s from patients? Patients are seeking their family history information are different from people who want to protect their family history, but those are both very serious issues that have arisen in our use case discussion. I mentioned destruction, and there's this whole idea of who is allowed to destroy, and that's ultimately based in the ownership. And Jen Stone from Security Metrics also brought up a really interesting point that in the US, ownership of data is driven by commerce, whereas in the EU, it's driven more by individual privacy. California and New York, she mentioned, are exceptions to that commerce driver in the US. But in general, we had a great discussion in person about how capitalism really is significantly impacting this project and private and sensitive data in libraries and archives in the States. Archivists and librarians, of course, are those data custodians who, in many cases, decide how and when the owner decisions are applied. And they've got their own local regulations, their own policies and procedures, and they've got classification rules that they follow. But those also differ from place to place, which can be a challenge. We also had a really great discussion of governance in person. And I know this is this has a long list here. I wanted to show you, we did an exercise at the in-person meeting of collecting sticky notes on boards. We had small groups break out and talk about these things, as well as service and cost models. But the governance discussion was one I wanted to point out specifically, because it did seem like we had aligned ideas about what good governance for this type of service might be, and it included everything in this list here. In fact, these were repeated recommendations, which is why I've highlighted them here. So centralized decision-making after consulting with stakeholders, diverse representation of institution types as well as practitioners and practitioner types, representation of the actual storage nodes in governance, making sure that they have a say, making sure that the governance is data and standards driven, that there is a clear vision, a mission, and roles and responsibilities, which seems like a no-brainer, but I've been part of collaborations where that was something that we backtracked to fill in later, and I think it's become very clear in these discussions that that should be very clear up front. The governance should foster collaboration and growth of those collaborative efforts. It should be responsive to legal fluctuation and jurisdictional differences that we pointed out before. There should be transparent financial reporting, and pretty much everyone agreed on this one. It came up several times. There should be a succession plan for when this, when or if a network can't go on any longer, where does that data go and how will it continue to be preserved? We also want governance to foster open communication. And we also want to make sure that governance allows for the data owner to keep control of the content. But of course, that requires that owner definition, which we were mentioning can be a very complicated thing. So finally, I just want to talk about our examination of costs and potential cost models. There's a lot of expertise on this project team. The team leads in particular have quite a bit of experience with the cost of distributed digital preservation. Chronopolis, of course, DuraCloud at Lyrasis, TDL's Digital Preservation Services, AP Trust, and all of us in some way or another were also involved in the Digital Preservation Network, and through that network did a lot of cost examination. Something that's coming to the fore immediately is that whatever happens, whatever kind of network is created, there would need to be significant seed funding up front because of the HIPAA compliance part. It's very costly to get to the point of HIPAA compliance, although by the time you get there, everything is basically procedural. An example is at TAC. They had a very large grant that established their private and sensitive data service, and it included significant physical changes to the facilities in which they were administering and storing all of the servers. But then after that, the cost of the private and sensitive data service at TAC is actually the exact same as any other storage for researchers. So finally, we're going to use the 4C project, which if you're not familiar with it, I've provided a link here, but it was an excellent project that examined the cost of curation. And so we're going to use that as guidance for modeling based on services and activities. And so that will also be information we include and recommendations in the final report. So what do we have left to do? We still want more use cases, and in particular, I wanted to call this out because those of you on the call can absolutely help with this. So if anyone's got a use case for the preservation of any kind of private and sensitive data, and it doesn't have to be just HIPAA and HERPA, HIPAA and FERPA, please reach out to us and we'll give you some information and ways to contact us on the next slide. We also need to continue reviewing and identifying the gaps in the agreements and the existing technological infrastructure. We've made quite a lot of progress here. So at this point, we're starting to start our drafting of the final report. And so we're just going to be kind of filling that in over the next several months. And then, of course, our final reporting out is going to recommend next steps, including the requirements for service and cost models that I mentioned before, based on all the feedback and investigation that we've gotten so far and anything that we collect from here forward. And I just wanted to highlight also, in addition to use cases, if you or your institution is interested in partnering for the continuation of this work via another grant in the future, please also contact us. We are interested in finding other partners who want to continue this meaningful and useful investigation. So that's all I have before we go into questions, but I just wanted to show you that you can contact us. So that's my email there first, and Sybil's their second. If you're interested in more project documentation, which currently has almost everything I've talked about today, except for some of the results from the in-person meeting and the graphics that are incomplete, that's our wiki link there. And you can read the full IMLS planning grant summary and full narrative at the link on the bottom. So with that, I think it's time to open up for questions.
Yes. Thank you so much to both of you for an incredibly informative presentation. So I had asked in the chat, and I should mention we're ready for your questions and your comments. Just be sure that the option is set to all participants. If it is set to all attendees for some reason, the host and the panelists can't see what you've typed. So that's kind of a bad sort of WebEx feature. It's not even really a feature. It's a bad UI situation. So I had asked how many attending the call have data that has this characteristics, and Jonathan from Virginia Tech said, well, we do our best to stay away from this. So it's kind of an avoidance strategy in this. And I think that that's probably a situation that many people are from. So just in Sybil and Courtney, how is that pretty common that you see people having sort of an avoidance practice? And if you could comment on how that's hampering people from getting done what they desire to do.
Yeah, that's actually I find that is pretty common, and it's actually what we do here at UCSD Library, not the health sciences. Of course, they have to have HIPAA compliant services. But UCSD Library, we've traditionally been like, if it has PII or PHI, and it's something that researchers want to give us for long-term stewardship, we generally turn it down. But we also recognize that some of the stuff that we've been turning down is very valuable and that we should actually be preserving it for the long term. So that's part of the reason for the impetus behind this grant, is so that we can actually take on that liability and preserve data and not just exclude it because of the information it contains.
And I could add to that I definitely agree with everything Sybil said, and the fact that readiness is definitely something, and avoidance is something that we're seeing emerge as the main issue. But I would say that extends in many cases just to regular digital preservation. I think that we've seen over the past several years that one of the easiest hurdles is the storage infrastructure. But to get to the point of storage, so many things have to happen institutionally and locally. And in many cases, that readiness just isn't there yet. And I think we saw that with the Digital Preservation Network.
Another thing to add to that, in addition to readiness, I feel like their libraries and archives especially already have data in unprocessed collections that they're not sure if it contains private or sensitive data. And so that's a case also that we are trying to look at. So here at UCSD, we have, I think it's about 8 terabytes of data that is unprocessed, and that is not distributed in Chronopolis. And it is very at risk because of its nature and where it's stored and how it's not networked and liable to hardware failures. But it's like, well, is there private and sensitive data on it? We don't actually know until those collections are processed. There's just the idea that there might be, and so caution precludes us from actually being able to preserve that data in a more responsible fashion.
Okay, great. So we have a question from Nathan Tallman. Great presentation. I agree. Presumably, encryption would be a component of the technological infrastructure. I didn't see any mention of the risk of storing encrypted content, fragility of encrypted files, key management, or how they would be mitigated. Will your recommendations address these risks or perhaps perceived risks?
I can take that first, and then Sybil, if you have anything to add. Encryption definitely came up at the in-person meeting, and it's a complicated issue. I think those of us who work in digital preservation mostly agree that encryption isn't good practice for digital preservation. However, HIPAA-compliant systems, when there is encryption, the keys have to be stored in the HIPAA system, which means that the way that we have discussed in digital preservation, encryption can be feasible is only if the keys are kept outside of the digital preservation system. And so that just doesn't align with recommendations from HIPAA. We will address it in the final report, but I don't know for sure. And in fact, I doubt we'll have any conclusions. I think it's just going to be a discussion and hopefully seed some further discussions around encryption and digital preservation, especially encryption in terms of private and sensitive data.
Thank you for that. Linda from Smithsonian Archives notes that personal identifiable information is a huge issue within email collections. So there's an area that's not health data, and I was struck by the number of your partners on this project that are health-related organizations, and thought that the human rights data was kind of an interesting exception to that data. So wonder how much you're hearing from people who their use case would be email files. And you're both muted, so if you're answering that, I'm not hearing the answer.
Courtney, I don't know if you want to take this one. I know we hadn't discussed email. I can't recall discussing email as a use case in our in-person meeting. I do remember we had a discussion of text messages. Someone who worked for the state of Texas noted that those particular messages were considered public records, and that there might be the necessity to preserve them. And I assume that some like text messaging and emails would be a little similar in the nature of their communication.
Yeah, we didn't have, we haven't collected any use cases yet around emails. So if if there is a use case that you can submit, we would love to add that. And we have basically the requirements for submitting a use case are about a half-hour conversation with our GRA, Hissam Andalib, and he's delightful. So if any of you have email use cases that you're willing to share, please do get in touch and we'll put you in connection with him.
Right, so that's a good point. So sharing use cases can be being interviewed by your delightful project team member. So low barrier to contributing use cases. Here's another comment from Nathan. You mentioned commerce, but have any financial sector organizations participated or been invited? Jane Mandelbaum has been working to connect infrastructure folks from these domains. There are many shared concerns over this type of data and perhaps things to learn from one another.
No, we haven't engaged yet with financial institutions, but would be willing, again, to hear use cases from those. I wonder if Jane could maybe make some connections for us. And thanks, Nathan. I might reach out to her.
Great. I am not seeing any other questions at this time. Just in terms of lack of user readiness, I think what would you say is kind of the biggest barrier for people kind of thinking about diving into this? Just the overall kind of scariness of it, or just what do you think is kind of the biggest barrier?
So from my perspective, it's paralysis in general around digital preservation, which I think is still a serious problem in institutions in the U.S. Not everywhere, but I think it's a serious problem. And then if you add on to that the problems around identifying all the stakeholders and identifying the owner, understanding the legality, and also, as Sybil mentioned, just unveiling those private and sensitive records and content that are within other born digital records or digitized records. I mean, I think that when all of that just piles on, everyone is just sort of stuck. And that stuckness is enabled by the fact that there isn't a solution right now for the storage piece, whereas there is for other regular digital preservation content. There are several options for that. But since there really isn't anything for private and sensitive data, there's not that impetus driving people to kind of speed up development on processing and learning those legal restrictions and whatnot. Sybil, do you have anything to add to that?
Yeah, I agree with what you just said, Courtney. I think it's the combination of having collections that are kind of amorphous and need processing to identify what exactly is in them. And then there's also just the appraisal process, which I think it applies to digital collections across the board, whether or not they have PHI or PII in them. There's just a general, I guess, hesitation when it comes to selecting materials that have long-term enduring value out of all of the other materials that a library may steward. And I think that comes to play when there's an actual per terabyte cost of preserving that comes along with selecting those items of enduring value.
Okay. Well, I've done a last call on questions, and I'm not seeing anything at this moment, but just to, here's one other comment from Nathan. There are various data privacy conversations happening in Congress. If we had GDPR in the US, recognizing we wouldn't have the actual same legislation, but if we did have GDPR, is DDP for sensitive private data possible? This is essentially about the ability to let data owners stay in control when the data lives in systems outside of their control. And I think that this was addressed somewhat in your kind of observation about commerce-driven systems versus systems like you see in Europe. So, any responses to
yeah?
Nathan's
So
observation?
I think what GDPR really does is transfer ownership of that information from a commerce-oriented entity to the individual represented in the data itself. So that would be an interesting changeover. And I think libraries and archives tend to be very respectful of people represented in the data to begin with. And so I wonder if that would be as big of a change from our perspective. I don't know, Courtney, if you wanna step in. I don't think I'm articulating very well what I'm trying to say.
No, I think you absolutely, I agree, and I think you absolutely did. The only thing I was going to add is that I think that what Nathan mentioned about the data owner staying in control when the data lives in systems outside their control, that really came up in talking about governance. So, and that came up outside of the context of GDPR, that just came up as an important consideration of governance. So I think add that to what Sybil said, and I think in terms of readiness, if something like the GDPR came to the States, I think we would be ready to transition and make any changes we needed to effectively apply whatever policies had to be put in place.
Okay, thank you. Outcomes from this, we will be sharing the recording, we'll be sharing links, and of course encouraging you to share your use cases and potentially consider partnering on next steps for this project. So thank you so much to Sybil and Courtney for sharing this information today. We're going to give you back 7 or 8 minutes of your time, and we hope you use them wisely. So thank you so much for attending and contributing to our conversation today, and this concludes today's webinar. Thank you all very much.
Thank you so much for hosting.
Yes, thank you, Marilee.